Okay, classification of ventilators. The ventilators can be classified in terms of various methods. Discussed below are general criteria for systematic classification of the ventilation based on the method on the inspiratory phase. A ventilator which operates independent of patient's inspiratory effort. Okay, the inspiration is initiated by mechanism which is controlled with respect to time, pressure, or another similar factor. Controlled ventilation is required for patients who are unable to breathe on their own. Assister, a ventilator which argues the inspirator of the augments the inspiration of the patient by operating in response to patient's inspiratory effort. This is assister. Assister and controller both has to work simultaneously to do a better job. Okay, based on the power transmission, based on the required power or the required breathing rate for a specific surgery or a specific need. No, these ventilators are coming into play. Then comes based on the pressure pattern. One is positive pressure, negative pressure, and positive atmosphere. So these are different pressure types on which a ventilator can be built, and these are their diagrams. Okay, okay, and based on the type of safety limit, volume limited, pressure limited, time limited. Ventilator in the predetermined volume cannot exceed during inspiration. So certain conditions required the volume to be controlled, certain conditions required pressure to be controlled, and certain conditions require time to be controlled. So based on these different conditions, the ventilators can be formulated. Based on cycling control. Cycling control of the ventilator is a device which determines the change from respiratory phase to expiratory phase. So based on the cycle, what I mean by cycle here is inspiration phase and expiration phase both accumulate one cycle. Okay, based on that they can control it. Cycling from inspiration to expiration. So you can volume cycle it, and you can even pressure cycle, time cycle. Okay, these are some of the types, and cycling from expiration to inspiration. So different ventilators are used in this scenario based on source of power, pneumatic, electric. So these are some important ventilators that has been types of ventilators that has been discussed in your book. Okay, so kindly when you are asked about classification of ventilators, kindly write them based on the different methods used in the given scenarios. Okay, thank you.